Hi, this is Dr. Prasad, prosthodontist and implantologist, KIMS Hospital, Secunderabad and Kondapur Consultant Branch. Today we are discussing about the dental lasers and its importance in dentistry. What are dental lasers? Dental lasers are the non-visible beam which we passed in certain nanometers or frequency wavelength where it disinfected the total areas. That is called as a dental laser. Where are all the areas we use dental lasers and what type of dental lasers are available? Dental lasers are available in two forms. One is soft tissue laser and second one is hard tissue laser. Soft tissue laser, by the name itself, it works only on the soft tissue. Soft tissue like gingiva, mucosa, cheek, muscles, frenums and all those areas. The second one is a hard tissue laser. Hard tissue laser is the laser which is used to work on the dental teeth. For example, caries removal and crown preparations, and for any cutting of the bone and all those things we used to do lasers. Why we are using lasers when we have a conventional methods? What are all the advantages of the lasers? The major advantage of the lasers is it is painless procedure. The first thing is painless procedure. So no need of anesthesia. 70% of the cases anesthesia is not required, so we can avoid anesthesia. And the second thing is no bleeding. There is no bleeding at all. Normally when you cut with your BP blade or any other thing for surgical procedure, you see profuse amount of bleeding in the area where the visibility is compromised. We have to suck all those things. In the laser, zero bleeding. There is no bleeding with the laser cuts. The third advantage is healing is faster and better. Healing is very faster and better. And fourth one is it won't damage to the neighboring tissues. The damage to neighboring tissues is also very less. And fifth one is with the help of the laser, when you are doing for the hard tissue, the normally with conventional the more heat and damage to the underlying pulp. With this the less heat, so damaging to the underlying pulp is got reduced. These are all the advantages of lasers. The disadvantage, the only one disadvantage is expensive. Where are all the areas we use for the lasers? The first and foremost area where we use is the disinfectant of the gingival infections. Normally when you are consuming the food and all the things every day 4 to 5 times, it will go and accumulate some or other place in your oral cavity and it creates the gingival infection. Once the infection got increased, you will get a swelling, gingival discoloration, pain, pus, lot of things will come. And finally mobility of the teeth also. To prevent all those things, we should remove all the infection area. We will remove all the infection. Previous days when we want to remove the infection, we used to open the flap and do the surgery and close the flap and it will take 15 days time to heal. But now it's not like that. Immediately we are doing that one with the laser itself, no cut, no bleeding, nothing. Immediately we are disinfecting the total oral cavity free of infection. That is the first and foremost. Second thing is we are removing the decay with the hard tissue lasers. Third one is we are doing preparations for the crown and bridge suitable. And fourth one is it enhances the healing capacity of the ulcers. Fifth one, it helps in bleaching. It also enhances the bleaching area. And sixth one is hyperpigmented areas. We can do normally when someone smiles, you can see the gingival discoloration into the black color. Normally it's a pale pink. For those people, the depigmentation treatment, the laser will help a lot. With the laser depigmentation, it's very easy healing and new cells which are coming will come in the color of pale. So this is the depigmentation technique. And the next one is when you have a joint problems, when you are opening and closing the joints, you will get a joint problems. To enhance the healing, every area enhancing the cleaning, disinfectant is the first and foremost thing and less bleeding. And finally, in the root canal treatment disinfectant, normally with the chemical tissues and all the chemical solutions, the amount of disinfectant is only 90%. If we use the lasers, it kills all the bacteria and emits the bacterial debris in the form of smoke. So no debris and no bacteria, total free. So 100% success rate with the laser disinfectant in the root canal treatment. So these are all the areas the lasers are advantageous, and applications of the lasers, and even the crown lengthening procedures also we will do with the lasers. Lot of procedures we are doing now with the lasers because of the advantages, and the only disadvantage what we have spoken is the expensive. So better to undergo the normal regular treatment replaced with the laser treatment for better healing and patient acceptance and patient convenience, because no anesthesia is required here. No anesthesia, no bleeding, no suturing, fast healing. So these are all the major advantages which is promotes the laser into the dentistry. Now most of the people, wherever you go, everyone is talking about the lasers only because of all these procedures. So better, the lasers are far most better than the conventional thing. So opt the laser technology treatments. Thank you.